A national social media campaign is putting a focus on warning signs pregnant and postpartum women should look for. The Hear Her campaign was launched by the CDC, and this month, the State Health Department started pushing it out in Minnesota. As Callan Gray reports, it's an attempt to save lives.
The CDC's Hear Her campaign is being amplified in Minnesota by the State Department of Health, highlighting urgent warning signs during and after pregnancy, and raising awareness that about 700 women die from pregnancy-related causes in the U.S. every year.
I have so many friends who have been pregnant who have said to their provider, like, what are you gonna do to make sure that I don't die? And no one should have to ask that question.
Dr. Rachel Hardiman is the director for the Center for Anti-Racism Research for Health Equity at the U of M, and she's served on the Minnesota Maternal Mortality Review Committee. The campaign points out Black birthing people make up 13% of the birthing population in Minnesota, but 27% of pregnancy-related deaths from 2017 to 2019.
I think this campaign can play a really important role in sort of helping to educate all of us and to really create scenarios for providers to ask pointed questions.
Social media posts, some featuring well-known athletes, encourage physicians and loved ones to listen when a pregnant person feels something is wrong.
Some symptoms in pregnancy and in postpartum can mimic normal signs and symptoms of pregnancy. And so we know that moms know themselves best. We want them to feel empowered to really express those concerns.
Certified nurse midwife Dr. Jennifer Almanza speaking to us alongside Dr. Rachel McGraw with MDH.
In Minnesota, most people who die of complications related to pregnancy are actually dying in the year postpartum. That's a time when people have less contact with the healthcare system in general. And so that's why friends and family are included in this, so that when somebody doesn't feel quite right, they can help get them to the care that they need.
Approximately 80% of these maternal deaths are preventable. We can change this and we can move the needle.
Some warning signs highlighted by the campaign are persistent or worsening headaches, vision changes, overwhelming tiredness, redness or pain in your arm or leg, and thoughts of harming yourself or your baby. This, again, is for people who are pregnant or who have been in the last year.
I like the idea they're targeting family members too, because they sometimes see it first, don't you think?
And they can have a real conversation about it and maybe reach that person in a different way.
Yeah. Important stuff, Kelly. Thank you very much.